On behalf of the Integrated Health and Wellbeing Council, I welcome all of you to another discussion as part of our series on prostate cancer awareness. This discussion is brought to you by Health and Wellbeing and supported by AstraZeneca Pharmaceuticals. I am Dr. Behjat, and today we'll be delving into the world of prostate cancer, a journey that begins with diagnosis and continues all your life. But it's not just about medical treatment, but also the emotional journey, the right that how can individuals better cope with the changes. So today we'll be topic navigating prostate cancer from diagnosis to survivorship. And to talk about this very pertinent issue, I am joined by Dr. Veenu Sarathi. He's a medical oncology consultant at Bangalore Baptist Hospital. Welcome to the discussion, Dr. Veenu.
Hello, ma'am. Good evening. On the forefront, thank you to IHW Council and AstraZeneca for this opportunity. Hopefully, we'll have a few questions over which we can spread awareness about prostate cancer, get a better understanding, and decrease the anxiety regarding prostate cancer.
Right. Thanks for taking out time and joining us here today, Dr. Veenu. So coming to the basic question, when we talk about, prostate cancer, there is a lot of, misconception. People have doubts and things that they want to clarify, and there is so limited, opportunities that are available. So we should be starting with, in an easy to understand way. How would you describe prostate cancer, as in what are the changes that can, happen to your body, and why should men be particularly aware of them?
Yeah, see, prostate cancer, it is unlike the other cancers. Why I would say this is, it is 90% a cancer of the elderly or the aged population. See, in fact, prostate during the reproductive period for males, which can go on even up to 65, 70, or even till full life, it is a very metabolically active tissue, which we say. So because of that, the tissue is constantly being replicated and repaired, so the chances of a mutation is high in them. So in fact, prostate cancer incidence is actually far more common than we actually presume or we actually think of it. In fact, when they have done a lot of research where they have done just an autopsy or post-mortem of people more than 70 years of age and found like almost 30 to 40% of them may have prostate cancer and lived with that for entire life without any symptoms. So it is far more common than we think. And we need not be too anxious about it or too stressed out about it, because it's such a metabolically active tissue. It is common to have mutations accumulating then which may manifest in prostate cancer. But what is important is most people with prostate cancer will not even know they have prostate cancer. They may live the whole life without even knowing. What is important is that people are aware that such an entity exists, and if recognized early and with good screening, we could eventually eliminate prostate cancer in them or give treatment at the right early stage and even cure them. Okay, and even with advanced prostate cancer, we see people living for a long, ripe old age with good medications and a good quality of life. So this is what I would like to address, that it is far more common than we think. It is important it is caught early so that we can treat early and cure the cancer. And in some of very elderly people, we need not even treat. They can just be on something called a very active surveillance or active follow-up.
You have talked about quality of life, something that I would come to, at that aspect when we talk about the treatment modalities involved and, the different staging processes. But starting with early symptoms, like you said, many people are not even aware of the thing that they're already suffering from this prostate cancer. So we'll also come to early diagnosis and what are the basic tests when we talk about PSA and what new innovations are there when it comes to early detection. But talking about some early warning signs, that especially our audience can gain some insight into how, they should be at certain age, they need to be, cautious of these symptoms.
Yeah, ma'am. So basically in prostate cancer, what we also see is most of them are incidentally detected, we say, where they go in for a general body checkup and then they find out that prostate is enlarged. or they do the PSA levels as part of their routine annual body checkup and they found it's mildly elevated. Almost 2/3 we can say, or up to 70% also are incidentally detected. It's very rare where we come across where the patient is presenting with a big disease which is spread to all parts of the body. That is a more rarer occasion, maybe 25% or up to 1/3 of the patients. So what I'd like to say is, with age, what happens with prostate cancer is, with age, the prostate gland normally enlarges. Okay, it is a normal benign process or a normal harmless process, and because of that, patients may have an issue with urination. They may feel that they are not voiding out completely. They have to frequently void. The nighttime voiding with disturbed sleep becomes more frequent, and most of them meet the doctor due to this. And most of the time, it's due to benign or a normal condition where with age the prostate enlarges. Very rarely these symptoms may be due to prostate cancer. So any elderly or any gentleman above 45, 50 years of age, if he's having trouble voiding urine, he feels the stream is not good, there's a stop and go, and he feels he has to use the restroom more often, his sleep is disturbed, I think this is the earliest sign we get, and we have to go and meet a doctor or a urologist or even an oncologist. But in terms of general population, I think right these days the screening guidelines are pretty clear, and these days many of the health insurance and health policies include PSA for any gentleman above 50 years, and PSA annual PSA screening has become a routine protocol for most people.
About the risk factors, though when we talk about prostate cancer, most of the risk factors are non-modifiable. But do you think Indian men genetically are more prone? Is there any research study that, that suggests that, yeah, it is something that is common in, in people of certain regions?
Yeah, actually, in the prostate cancer was usually not thought to be of as a genetic disease. It's more, like I said, it's a disease of the elderly due to accumulating mutations with age. But these days, we are seeing maybe 5 or even up to 10% may be genetic. But even then, the data is more in the Western population, the black population, where they have the genes or the polymorphisms, which we say, which more predisposes them to prostate cancer. So as such, for us, the main risk factor or what we say is the age. Its genetic is very rare, maybe 5 to 10%, where we would suspect if in somebody with very young prostate cancer, less than 45 years, or somebody with a strong family history, then we would say. Otherwise, it's usually not a genetic cancer. So what, like you said, it is non-modifiable, most of the risk factors. We exactly still do not know the exact reason. Previously, what would happen is they would use a contrast agent or a pesticide fertilizers called Agent Orange and all that in Vietnam and other Southeast Asian countries, where it was known to accumulate in the prostatic secretion and cause cancer. But these days, all those chemicals have been eliminated. We don't have the harmful chemicals being used in anywhere, any of the pesticides or fertilizers. So most of it, what we do attribute is due to we don't know whether it is absolutely because of that, but they may have a contributing factor, which is definitely a diet which is high in meat, high in cholesterol, obesity, less fruits, vegetables, less fiber in the diet, less of physical activity, probably alcohol, smoking. It's still not a direct causal relationship, but maybe all this contributing. And of course, anybody with diabetes, recurrent urinary tract infections, some amount of heavy metals, less of vitamin D, all these are known to be a contributory factors. But still today, what we still know is with higher age, the risk of prostate cancer higher. All these other factors may further contribute a little more. This is what, so that is why every man above the age of 50 years should possibly be vigilant about this and get screened regularly.
Very rightly have pointed out how after a certain age men should be vigilant, and that is what the whole idea behind such discussions is, to create that level of awareness. Coming to you also mentioned about it in the beginning of the discussion that the earlier it is detected, the better it is, and it is true for other cancers as well, and that is what we keep on saying, that go for diagnostic tests, detect, early detection can play a very important role in better health outcome. So when we talk about prostate cancer and early diagnostic opportunities, what are some of the, apart from PSA, that is one basic test, other than that, what are the other advanced diagnostic techniques that are there?
Yeah, so first for screening, PSA is more than sufficient. So we do a PSA, which is a simple blood test, which is one of the markers or chemicals secreted by the prostate gland and the cells of the prostate cancer. So we usually have a cutoff of 4 nanogram per milliliter, above which tells us that we may need to image more. Okay, previously there was that people would do a digital rectal examination for prostate, what we would say, where we had to manually examine through the rectum, but these days they have found that does not contribute much. So first we do a PSA. If the PSA is high, then we move on next to an ultrasound, which is just a simple imaging, OPD procedure, ultrasound, where non-invasive imaging, we look for the prostate size. And if we do find that big and bulky, then we, of course, we go ahead for further investigation, invasive investigation. The first step will be PSA. If PSA is more than 10, we definitely need to go for something called a prostate biopsy. When the biopsy is fairly, if not too invasive, they pass ultrasound guided probe through the rectum and get small pieces of the prostatic tissue under local anesthesia. If the PSA is not very high, between 4 to 10, we could see for repeated PSA monitoring at possibly 4 to 6 week intervals, and then look, if it is rapidly rising, then we may need a biopsy. Once that, if it is established to be prostatic cancer, of course, these days, previously we used to do bone scan and all that, because prostate cancer commonly goes to bone and an MRI pelvis. But these days we have much more advanced modalities called PET scan. PET scan, there's a specific PET scan for prostate tumor called PSMA PET scan. We have all much more advanced modalities with which we can detect the stage where all it has spread. So the first step would be, of course, PSA, and based on that, we take it forward.
Right. So when we talk about the treatment modalities, that would also depend on the stage that you are in.
Right.
So if you could just walk us through the different stages and what treatment modalities are, there for each stage.
Yeah, so prostate cancer, for making it simpler, we have limited and advanced. Limited means it's restricted to the prostate and maybe the surrounding areas. Advanced is it's gone beyond the pelvis or beyond the hip. It has gone into the abdomen, or it's gone to the bones or other organs. So this is what we do is, like I said, many people may have prostate cancer for which treatment may not be required at all. They may live to a ripe old age they may never die of prostate cancer, or it may never cause symptoms. So especially in very elderly, maybe 70 or 75 year plus gentlemen. So what we do is, if we have a prostate cancer established and we find it's of a very low grade or a low flow growing biology, we can also do something called wait and watch or active surveillance, where we just follow up with the patients every 3 months with a PSA, regular scans, and only start treatment if it's causing the gentleman symptoms or it is rapidly growing. But this is also a treatment modality which is there. Otherwise, if it's a younger person or a little higher risk cancer, where it's a higher grade cancer, then what we do is, like I said, for the first stage of cancer or localized prostate cancer, the 5-year survival, what we say for cancer, or the chance of making it up to 5 years being cancer free, is almost 100%. So which means if prostate cancer detected early, your chance of being cancer free at 5 years is almost close to 100%. So for early stage, we have 2 therapies. One is what we call hormone deprivation. Your prostate cancer grows because of testosterone. Testosterone is the fuel. The male hormone is the fuel for prostate cancer. So we cut off the testosterone either medically or surgically. Medically is through an injection. Surgically is where it involves removal of the testis. And then once the cancer cells shrink, we can either remove the prostate cancer with a surgery, or also treat it non-surgically with radiotherapy. And with this modalities, we have very effective cures, like I said, in early stage 1 and 2, even up to 100% cure rates. But in later stage prostate cancer, where it's spread beyond the pelvis or beyond the hips into the bones, we may not be looking at a cure, but we have very good hormonal therapies, like I said, which cuts off the testosterone to the cancer. Further, we have very good testosterone receptor blockers. We have newer nuclear therapies called lutetium therapies. We have chemotherapy, of course, which is late stage. So we have a lot of things with which we can greatly improve the quality of life and survival. So even in stage 4, we do see almost 35 to 40% of them living beyond 5 years with a good quality of life. So unlike other cancers, even in stage 4, we could offer them a very good treatment.
Right. Dr. Vinu, you touched upon the aspect of how quality of life is important for patients.
Right.
And I'm sure that while taking those treatment decisions, about which modality to go for, this is one of the most important aspects, that quality of life should not be, should be prioritized and should not be negated as such. So when we talk about the treatment modalities and of course their side effects, what are though with advanced technologies, side effects have now, lessened down to a greater extent. But what are some of the common side effects that, people who are undergoing different treatment modalities for prostate cancer can, experience?
Yeah, so prostate cancer, the treatment is mainly intended at hormonal therapy or withdrawing testosterone from the patient. So you do not have the classical chemotherapy related side effects. So when you withdraw testosterone from the patient, they mainly feel a little fatigued, little low mood. They have a little loss of muscle mass. Initially, for the few weeks, due to the adjustment, they may have some hot flushes. They may feel a little irritable or mood disorders. Apart from that, I think they come around all that in a couple of months, and they can really bounce back and have a good quality of life. You do not have chemo like side effects like decreased immunity or hair loss and or diarrhea. All that you do not see them classically with this. And even with respect to local therapies, we do have very cutting edge surgical techniques like robotic these days, where only the healing is very rapid with minimal side effects. And we can also completely avoid surgery and do radiotherapy with these days we have modern machines which very strictly only gives the dose to the prostate cancer and spares the surrounding tissues with very minimal side effects. So as of quality of life, we do have very good treatment for prostate cancer with minimal side effects, which is very much manageable. Even the later stage chemotherapy for prostate is a relatively milder because it's a disease of the elderly. The regimens are designed such that they can tolerate it, and always keeping in mind the quality of life of the patient.
Right, very rightly have pointed out about how quality of life has to be maintained, but we have only discussed about the physical aspect. What about the mental aspect? Because when you start that journey and the whole process, the whole path can be mentally exhausting for a patient. So how important is counseling in that respect, and how is it ensured that not only the patient but the caregiver, partners, support, family which is there is also involved in the whole process to make it easier for the patient to deal with the emotional side?
Yeah, I think it's definitely, I think this is one aspect where nowadays we are all incorporating it early, and we are also taking it seriously, the mental aspects and the emotional well-being. We are, and not just the physical side effects of therapy. So it's very important the patient is explained, and especially also that we have to tell him about the loss of libido and all that which comes in with the withdrawal of testosterone. We involve the family. If required, we also have a clinical psychologist there and tell them that you will experience a little low mood first few weeks, tiredness, fatigue, but you will get over all that, and you slowly with time you'll get stronger. And as you see the results of the tumor shrinking, it's going to give you confidence. So it is very important. It's probably as important as the physical therapy itself. So we do involve from the very first meeting, we do involve the family. We tell the patient what to expect. If required, we do also get specialist help of a clinical psychologist or onco-psychologist, and really does help in a great way. The patient is able to accept much better, adhere to treatment much better, and the outcomes are definitely much better.
about follow-up, because it's not that you had that prostate cancer, you went for your treatment and it's all over. It's a lifelong process that continues. So when we talk about follow-up, of course that is important, but along with those medical interventions, do you think when it comes to survivorship and life after cancer, you think diet, your whole lifestyle also plays an important role? Because that is also an important part of your holistic well-being.
Yeah, ma'am. Well said. Because post even the survivors of prostate cancer, because the testosterone has been withheld, like I said, they are at a little greater risk compared to regular population of heart issues, maybe increased atherosclerosis, increased events. So we do tell them that please keep themselves engaged in a very balanced diet, plenty of fresh fruits, vegetables, more fiber, less of saturated fat. Advise them 120 to 150 minutes of aerobic exercise every week, and engage in some mindfulness like yoga or meditation, and engage in social interactions with friends. And all this helps them to increase the energy levels, improve the immunity levels, and definitely also keeps the morale up in a big way. So definitely it plays a major role. And we do see people who follow all this, their recoveries are better, their outcomes are much better than people who do not. So definitely it plays a major role.
Rightly have pointed out the importance of the whole lifestyle change that is imperative for your health. Coming to the treatment part, because we have seen breakthroughs in medical technology. If we talk about how AI is transforming the whole landscape, telemedicine, and so in the coming decade, or in the recent research and development section, what is your take? How is technology going to change when we talk about diagnosis, especially how is it please continue.
So I think with early detection we do have we currently using PSA levels, but I'm sure pretty going forward we are going to have a much more efficient biomarker test, or along with PSA we may add on few more molecules with blood tests which may detect prostate cancer even earlier with higher accuracy. So we may be able to get a blood test which predicts you may get prostate cancer maybe 5 years in advance only. That is definitely going to be there. And going forward we do have, previously prostate cancer means we would have only hormonal therapy and maybe chemo. These days we have targeted therapies. We see 15 to 20% of prostate cancer which may have mutations which we see in breast or ovarian cancer, and we can repurpose those drugs for these. And nowadays we have a nuclear medicine where we are tagging a radionuclide specifically to go and hit the cancer cells only and spare the other normal tissues, which is called theranostics. That is also really approved now, and it's come in a big way. Going forward, we may have more of immunotherapy coming into prostate cancer, and many more things where you don't have to do a major surgery, and we could just treat them with just simple injections and tablets. So definitely going forward, there's a lot of research going on in prostate cancer, and we will be getting much more drugs and diagnostics where we can detect early, and even cure rates may be increased even much more.
So when we talk about cancer, especially, there are a lot of myths, and in the Indian mindset, there's this stigma, you can say, related with the C word. So in your practice as an oncologist, what are some of the myths and misconceptions that you have come across, and how can you according to you, how can that awareness gap, that lag which is there, that can be effectively bridged for better knowledge creation, so that people have better awareness around these important health issues?
First thing is there is some people who there's a stigma associated with cancer, and they don't come out early, and they think that it's unfortunate that they think that just ignoring the problem may possibly go away. So first, I would like to tell them, just come out and take treatment as early as possible, so we can maximize the chance at a cure. Secondly, cancer is not contagious. Okay, it is not. So the caretakers especially need not worry that if they're caring for the patient, they are going to get cancer, or the kids in the house will get. It's not like that. And thirdly, most of the cancers are due to what mutations we pick up during our lifetime, not genetic. Very less cancers are genetic. So again, need not worry that it is going to affect your married life or it is going to pass on to the next generation. So that is one more myth we have. And regarding whether any food to be changed during treatment or after treatment, nothing to need not do anything too dramatic. Just stick to clean, balanced diet. Is nothing like there is no miracle food or anything which could result in a cure. Rather, it just helps you boost your immunity and nutrition value. That's more important. This we do see, and as much as possible, it is better if they stick to proven therapies and proven treatment, which is backed by a lot of evidence, rather than trying a non-proven treatment or an alternate management. Of course, there may be many alternate treatment which is showing promise, but we still don't know. So maybe they can be used as an add-on or later when the conventional therapies fail. So this would be the our suggestion that come out early, get treatment, and maximize the cure, and stick to proven treatment. And not side effects are definitely manageable. In cancer, many people think chemotherapy causes pain. Chemotherapy causes more damage than the cancer itself. In fact, cancer cure is more dangerous than cancer. All that is a myth. Chemotherapy can be managed very effectively. The side effects can very well be managed. The treatment is the no treatment is intended with the intention of being more dangerous than the disease itself. So that is one more thing I wanted to stress upon.
Dr. Vinu, very rightly you have pointed out, because that's the general perception when it comes to cancer, that, treatment and especially chemo has a lot of, nausea hota hai, quality of life kharab ho jayegi and things like that. But yes, you are very right in that approach, that at the end of the day, it has to have a, a balance of the side effects versus how the cancer could impact your life, which could be worse in many situations. So, coming to the final part of the discussion, any words of encouragement, advice that you would like to, give to people who have, survived prostate cancer and now they are thriving in their respective fields, and, and about even to the general audience about how awareness is important, seeking early medical intervention in case of any abnormality, how that can proactively work for their better health.
Right, ma'am. I think for people who are having this disease, who are fighting this, who are survivors, I think they are the greatest warriors. I think we can never understand what they go through because we have never experienced anything like that, or we have never experienced the side effects of the treatment. So it's we definitely we also derive a lot of inspiration from them, and a big salute to them. And so we usually, what happens when we see some patient who are little doubtful of the treatment, we also quote or we ask them to interact with some survivors so they get hope that seeking treatment early, taking treatment can cure them and they can move on with a good quality of life. So it's very important that sometimes as a doctor also, maybe 100% of time we're not able to convince patients because they also feel that sometimes we do not know what they're going through because and it's always better than when they reach out to somebody with a first person experience who's been through this, and then they get completely convinced. So definitely they play a major role in interacting and helping out. And they also make it clear that when you come for screening, you're diagnosed early, it definitely makes a big difference. The cure rates are much more increased, and it's not something you to be too anxious or worried about. With good awareness, good counseling, the more we speak to each other about this, the more people realize that there are cancers like breast, cancers like colon cancer, like prostate, which can be screened and caught early. And the more people know, more will be diagnosed early, and more can even be prevented by knowing what are all the risk factors. We can actually eliminate or even cure this disease in most people.
Right, Dr. Venu, that indeed was a very, very enlightening session, and thanks for taking out time from your, busy schedule and joining us today and sharing your knowledge with us. I'm sure that, the audience will take away a lot of relevant information, which will prove beneficial for them in the longer run. And thank you once again. This session was specially brought to you by the IHW Council and supported by AstraZeneca Pharmaceuticals. Everyone who has tuned in, thank you. Remember, knowing about prostate cancer and catching it early can make a huge difference. So just keep the conversation going. Reach out to friends, family, and support whenever in need. And that is all for today. Thank you once again, Dr. Veenu.
Thank you so much. It is an honor and privilege. Thank you.
Another important discussion in our Cancer Awareness Series. Please keep on following our social media pages for more updated information on health. Thank you.